Hello, sir. Good evening, sir. Is my voice audible, sir?
Yeah, it's audible.
Good evening, sir.
Good evening. Yes.
Good evening. Am I audible?
Yes, sir.
Is the voice clear?
Yes, sir. It's clear, sir.
Thank you.
Sir, myself, Sri Lakshmi E, here representing. Sir, is there any screen sharing, sir?
Yes, I have a PPT prepared.
Okay, sir.
Please tell and I have to share the screen.
Yes, sir. Sir, there will be a welcome address and there will be an introduction section too, sir.
Okay.
Namaste and good evening to one and all. Today, on the SAMSIDDHI 2021, we have with us Dr. S. Gopikrishna, who is here to talk about the role of Virudha Hara in autoimmune disorders. Dr. S. Gopikrishna has completed his BAMS from SDM College of Ayurveda, Udupi, the year 2002, post which he did his PG in Agatatantra from Government Ayurveda College, Trivandrum, and completed it in 2008. He worked as assistant professor in SDM College of Udupi from 2008 to 2012, and currently he's working as assistant professor in VPSV Ayurveda College, Kottakkal from 2012 till today. Sir has presented in various forums on Agatatantra, the role of Agatatantra in skin disease management, as well as management of Visha conditions. So we are really glad and excited to hear this from you, sir. Over to you, sir.
Thank you, Dr. Hari. First of all, I thank the organizers for giving me an opportunity to share my views.
Can you make it a bit louder, sir?
On the concepts? Sure. Is it audible now? Is it audible now?
It's better, yeah.
Now?
Yeah.
First of all, I thank the organizers for giving me an opportunity to share my views on the concepts of Vishachikitsa, and I have presented a very small topic on Vishachikitsa before, the approach of Vishachikitsa in the same AVP foundation. Today, the topic for discussion is Virudha Hara and autoimmune disorders. Shall I start sharing the screen?
Yeah, please. Yeah, please.
Is the screen visible?
Yes, sir. It's visible,
yes, sir.
sir.
वागर्थाविव सम्पृक्तौ वागर्थ प्रतिपत्तये जगतः पितरौ वन्दे पार्वती परमेश्वरौ. This is a very famous quotation from Manusmriti, which tells an intimate relation between ahara and our manas. If ahara is shuddha, manas is considered to be shuddha. Ahara shuddhau sattva shuddhi, which means to attain sattva shuddhi, ahara shuddhi is a must. So why this is so relevant? Because our science is so much related to the food, the diet habits, the way we eat the food, how it gets digested, as well as what will be the result if the diet pattern is totally mistaken or totally out of the track. One such topic we will discuss today. One aspect of Ahara Shuddhi is going to be discussed. These are the random references that we come across in our Samhita, where we can see Viruddhani. I have marked it. Viruddhani, Sankirna Bhojanat, Virodhi Nyannapanani, Viruddha, Virodhi, Dushta, Gara. All these words are explained in almost all the chapters when we go through the Nidanas or when we go through the diets. Everywhere, this single word has its own relevance in the formation, in the manifestation of the Samprapti, and finally landing up in a disorder. And this is one of the references that we come across in Charaka Samhita while explaining about Shonitaja Vikara, where the maximum amount or maximum number of diet patterns have been mentioned. The reference is from Charaka Sutrasthana, 24th chapter, where he mentions Pradushta, Bahu, all these things are related to food. And if you see that underlined word, 1 minute. Turn off my. All these words finally lead into Viruddhana, Upaklinna, Putina, Bhakshanena cha, Bhuktva, Diva, Praswapatam, Drava, Snigdha Guruni cha. All these are again relevant as far as Shonita is concerned. I will tell as the discussion progresses why I selected this particular reference, which is pertaining to the Shonita Javikaras itself. Viruddha and autoimmune disorders. This is one reference that we come across during our initial days of graduation, that to first year BAMS, where we will be pretty much fancied by the name of a Matsya called Chilachima. Then we forget. When the syllabus increases, it goes on, we advance to the Nidana or we advance to the Chikitsa, Panchakarma, and then to the practice. Chilachima will be in one of the corners of our mind. And the concept also in a similar way. If you see this reference, it is one of the depictures of Virudha and its possible damage that it can cause once it is taken frequently or it is taken once in a while. So, Ati, Abhishyanti, Tamatvat. It is Abhishyanti Tamatvat. Sutaram, Vyadhin, Upajanayati, Ama, Visham, Cha. So, it is in the context of Virudha. If it is taken for a long time, it will be causing Abhishyanda and definitely it will cause Vyadhi and in the form of Amavisha that can cause again and again. One example for Virudha, Chilichima, Matsya. But it has again that Abhishyandi factor in it, Amavisha factor in it, Matra in it, mixing in it. So all these things are relevant when we go on to learn about Nidana, Samprapti and Chikitsa. Now, what is Virudha? In this presentation, I will be discussing about initial concepts about Virudha and where they can be applied in our clinics, and a few of the autoimmune disorders, and let us plan how we can approach to the treatment. Always I usually keep the photos of patients or clinical conditions, but today I have not included that because of references itself are too much. So I will go on telling each and every clinical cases that can possibly come to our OP as and when the discussion is going on. This is the definition of Virudha. Yatkinchit doshamasravya nanirharati kayatah ahara jatam tat sarvam ahitaya upapadyate. So how can we interpret this shloka? Let me put this reference in a different way. It is ahar jatam, related to food. Ahara jatam. Tat sarvam ahitaya upapadyate. Ahar jatam, it is related to food. It is only related to food. And what does it cost? It is just like a bank balance. Once it gets accumulated, now that accumulated thing, instead of causing a healthy continuum of our health, at times there can be problems related to income tax, problems related to rate, problem related to money inquiries. Similarly, food also will be in that manner if it is not properly processed, and it has to get out in one way or the other. But what happens here is nanirharati kayatah, such ahara which is not getting absorbed and assimilated and excreted in a proper way, nanirharati kayatah, it will cause disorder. And what sort of food? Yat kinchit doshamasravya, which is capable enough, the food which is capable enough to cause utklesha of the dosha, and thereby which will not have a capacity to expel itself out of the body. Now comes the question, Vamana Virechana is also causing utklesha of the doshas, but why not they are considered as Virudha? Because they have their own innate quality to expel the doshas out, but not a Virudha ahara or a Virudha dravya. They may not have the capacity to expel it out. If it is expelled out, well and good. Everything is into normal now. But a Virudha dravya, a Virudha ahara is not in a position to expel itself out, even though there is dosha, utklesha because of its intake. So ahara jata is one word that we have to keep in the mind. It is sufficient to cause a bahudosha avastha in a patient. I am putting a new word, bahudosha avastha, in the patient, but they are not capable enough to expel out. This is another reference from Ashtanga Sangraha. Similar thing, but one word has been added in this. Viruddham tat hi dhatunam pratyanikataya sthitam. Now comes the role of dhatu. So dosha, once get deranged, will start deranging the dhatu once it starts getting assimilated in the body. So dhatu is a prime factor here. Rasa, rakta, mamsa, meda, asti, majja and shukra. And once its impact is too big, it can even affect ojas. It is just like a monkey entering into a field and destroying the whole cultivation. And one more thing will happen there. If one monkey is deranged, other monkeys will also tend to get deranged. So this is what happens in the body when dosha again cause initiated, again affecting the dhatu, and dhatu will start acting there. So this is an advanced level of definition where viruddham tadhi dhatunam pratyanikataya sthitam, where dhatu will also be affected in due course, which can even affect the ojas. Now again, a new word I have put forth. Ojas is also coming into picture. Let us see how ojas is affected in the further slides. So dosha we discussed, utklishta we discussed, which is not able to expel itself out, is told, and it starts causing derangement in the body. Again, it deranges the dhatu, again not going out, causing ill effect on the subsequent dhatus, reaching up to the ojas. Bahudosha avastha is also not to be forgotten. This is from Sushruta. Sushruta is very clear about it. Yat kinchit dosham utkleshya bhuktam. Yat kinchit dosham utkleshya bhuktam kayat na nirharet. Bhuktam, ahara, is not at all getting expelled out. Prasadishvayathartham va tad vikaraya kalpate. Prasadishu, prasadi saptathatu, tad vikaraya kalpate. It will cause disorders. If you see that red box, the prime important area is covered. Prasadi dhatu dushti karamapi vyadhaye bhavati ityaha prasadishvadi. Prasadi dhatu dushana karamityartaha. It causes rasa adi dhatu dushana in it. Vishishta shaktitvat dravyanam. Why that word is mentioned? Dosha dushtikaritvena dhatu dushana karatvam nalabhyate. I won't go more to the theory into it, but there has a special ability for such amavisha which can cause very drastic changes in the body as far as the samprapti is concerned. We will see when the autoimmune disorders are discussed. How a viruddha can act in the body. It enters through food, and it can be unwholesome or an improper combination which is taken in a non-seasonal way, or it can be untimely also, untimed intake of food, or non-seasonal availability of foodstuffs is taken. That also can cause viruddha, and the processing can also cause viruddha. But clinically, in a superficial way, while elaborating the history, while inquiring the history, we just go on asking about his diet and we forget about these factors. So that has not to be definitely forgotten. We should remember while taking history, because history taking is a prime important factor to identify the viruddha, or else there can be real mistake from the physician side in assessing the samprapti, thereby writing a proper prescription through food, and it is prepared in an unwholesome way or improper combination, and it can be non-seasonal also, and the untimely food also, taking food at midnight. We have a habit of taking the food even at midnight, a lot of people, and also the processing of food. If it is not proper, there can be a very, very damaging effect in the body. Now, why? The possibility are intentional, or an incidental, or a metallic contamination can be there, or accidental possibilities also there. How come intentional? It can be intentionally mixed as a part of food adulteration. Such food, if we take, there can be possibility of viruddha. Incidentally, pesticides, definitely. The cultivation, pesticides are definitely used, and storage, like dropping of rodents will be there, or larvae. Such food we get from the shops, which are expiry date already over. Such food, they are really incidental, they happen. And metallic contamination in the soil, naturally, lead, mercury, or arsenic, or a part of preservative. We have been incidents in Kerala where the fishes have been preserved in arsenic or mercury has been used as a preservative. Such things are commonly seen in the papers nowadays. And also accidental packing of food, hot food, boiled food. We take parcel to our home. They will be packed in the plastic containers, and that can also be changing into a disease-causing factor. Now, where to place? Now, where exactly we can place Virudha? अथातो विरुद्धान्न विज्ञानीयम अध्यायम व्याख्यास्यामः इति अस्माहुरात्रे यादयो महर्षयः अष्टांग संग्रह. See, one new word is there in Sutrasthana itself, in the commentary. Hindu आहारस्य प्रसक्तत्वात् विरुद्धस्य च तस्य गरसदृशत्वात् तत्प्रसंगम. Gara is one new word which has entered now. Gara. So there is something in between Gara and Virudha. We inquire about Gara, we inquire about Virudha, but there is something similar. There is some factors which run hand in hand when we think of Gara and Virudha. So somewhere in the concept, in the broad area of Gara, I think Gara will be a topic for discussion for one whole session. So I will concise it when we discuss about Gara. So Gara is a very big umbrella, out of which one person who is taking the shade of that umbrella is Virudha. This is Charaka's explanation of Gara, out of which we are only interested in that 6th or 7th line of Chakrapani commentary, where Virudha is absolutely placed. Dushi Visham Agre Vakshyati Tat Trividha Antargatam Darshayishyamaha Garam tu Dvividham. So Gara is of two types. One is Nirvisha Dravya Samyoga Krita. That absolutely is Virudha. A non-toxic combination when combined together, or when it undergoes a process, when they are mixed together, they can act adversely in the body. So Nirvisha Dravya Samyoga Krita. Now keep all the Savisha Dravya Samyoga aside. That is not the area of discussion today. Nirvisha Dravya Samyoga Krita is the word given by Chakrapani, who has taken this reference from Kashyapa. So Gara, one of the aspect of Gara is Virudha. This is the substantiating references. Garam syata visham tatra. Whatever we have discussed here, the combination, the processing, the time, the season, everything can be non-toxic, but that particular factor which runs during that time can be toxic in nature, which can cause a new disorder. Nirvisha Dravya Samyoga Krita. And what is Samyoga? Samyoga is Punaha Dvayo Bahunam Va Dravyanam Samhati Bhavaha. So two or more drugs or materials when combined together can be called as Samyoga. So Nirvisha Dravya Samyoga Krita. Definitely we have to be very careful while writing the prescription now. A non-poisonous, non-toxic drug, if given injudiciously in a wrong combination, can act as a new symptom in a patient. Tathaushadam avijnatam vijnatam amritam yatha. Charaka Sutrasthana, 1st chapter, where he mentions Yatha Visham, Yatha Shastram, Yatha Agni, Ashaniryata, Tathaushadam avijnatam vijnatam amritam yatha. Even a prescription written by us without taking the samprapti in a proper way, without coming to a proper conclusion, can be Virudha. So we have to be very careful now. It goes on another perspective, just with the interest that Virudha Ahara, not, but Virudha medicine combination. Another perspective. This is taken from Visha Chikitsa, where Gara is explained. Nana Pranyanga Shamala Viruddhaushadhi Basmanam. This is what Charaka Sutrasthana, while mentioning about Visha, Shastra, Agni, Ashani, sort of complications can be there because of a faulty prescription, is coming under this purview. Viruddhaushadhi Basmanam, Vishanam cha Alpaviryanam. yogo gara iti smritaha. There is no concept called if visha is in a very small way, it won't affect. If it is in a much bigger quantity, it can cause a drastic disorder. No. Even though visha is in a very small quantity, it can act deleteriously. It can act as a disease causing factor, even if not today, tomorrow. In some other conditions, it can cause a new disorder, a new samprapti. This is another definition from Sushruta, where he mentions yoga iti nana vidhaihi. So yoga is a combination again. Nana vidhaihi esham churnani garamyadeshet dushi visha prakaranam tatha chapi anulepanat. Now comes the importance of dushi visha here. So we started with an unwholesome combination of food. We came to the word utklishta. We came through which is not able to expel itself out of the body. We reached to dhatu dushti. We reached to ojas. We reached to amavisha. Then we came to gara, because in the chapter of Sutrasthana, where while mentioning about Virudha Vijnaniya, he told gara, and gara we saw there was Virudha, and when we reach the gara, he is showing us Dushi Visha. So all these are related in a very intricate but a very definite way. Tatha Chapi Anulepanat is not our topic today. So all these are related in this reference of Ashtanga Hridaya Sutrasthana. Every combination can cause a disorder today or tomorrow in an acute or a subacute or a chronic fashion. Viruddham apichaharam vidyat visha garobamam. This is also a reference we learn in first year BMS, right? But the commentary is an eye-opener. Ayurveda Rasayana commentary, Vishavat Sadyo Nashakatvat. Virudha is dangerous in the form of Visha. It can cause Sadyo Nashakatvat, immediate death. We will see some of the cases of autoimmune disorders, Sadyo Nashakatvat, Kasyachit, Garavat, Kalantara Nashakatvat, Rogajanakatvat, Kalantara Nashakatvat, Rogajanakatvat. They can keep on person troubling in one way or the other. The samprapti will never end. Now we have to think of Prameho, Anushanginam, Pushtam, Dirgharoganam, Yakshmo, Rogasamohanam. Everywhere this sort of Rogajanakatva or Kalantara Nashakatva is there in a few disorders. That is where we have to explore when we think of autoimmune disorders. Now, Satyo Nashayati, where Vyadhim, Indriya, this is reference is from Sushruta as well as Charaka. Both have mentioned this. Vyadhim, Indriya Daurbalyam. Every word, I request you to see each and every word as a relevant thing, because while we discuss about the modern topic, every word will again repeat. Vyadhim, Indriya Daurbalyam. So, Vyadhi, Indriya Daurbalya, Maranam cha adhigacchati, Viruddha rasa viryani, Bhunja. What he has to eat is the basic cause for disease. If a person doesn't know what he has to eat, how he has to eat, now Viruddha rasa viryani will definitely cause Vyadhi or Indriya Daurbalya or even Marana. And this is our famous quotation of 18 types of Viruddha that we are not going to discuss today, because we already know the theoretical aspect of Desha, Kala, Agni, Matra, Satnya, Anila, Adivihi, Samskarato, Viryatascha, everything. We are very familiar with that. We know the examples, Grita, Madhu, everything we discuss in the theory. But 18 types of Viruddhas are there, but how they influence in the disease, we will discuss by discussing about Gara and Dushi and its manifestation. This is the clinical presentation. Shandya. First word itself is infertility, Shukra, and Rasa. This Shandya is a very characteristic disorder where Dhatu Pradosha Vikara, Charaka Sutra Sthana, Shandya, or the direct translated terminology, infertility, is mentioned in Rasa as well as Shukra. That word has been definitely put first in the first name itself, that word. Andhya, Indriya Daurbalyam was the word we discussed 2 slides before. Visarpa, Dakodaranam, Vispotaka, a sudden eruptive skin lesion. Visarpa, a skin disorder or a disorder. Visarpa is a very wide disorder. Only we cannot consider herpes as Visarpa. Even if we see Ashtanga Hridaya, Granthija Visarpa, we can know that a lymphoid leukemia case can exactly be similar to Granthija Visarpa. So, my request is kindly note the symptom of a disorder will not be as it is explained. If we go deeper into the references, we can get much more new samprapti or new presentations in it. One such example is Visarpa. Here he has mentioned Visarpa. We will think as herpes. No, it need not be only herpes. If we see the Granthija Visarpa reference, a case of lymphoid leukemia can be Visarpa. A case of pemphigus can be Kardama Visarpa. So even again, if we ask if pemphigus a Kardama Visarpa case, no, it need not be. A case of pemphigus can be in Avaranavata also. Only Nidana or the Samprapti, we can just fix the case where it has to be exactly placed as per the presenting complaints. So Visarpa is not only herpes, it can be a case of leukemia or pemphigus vulgaris. Now pemphigus vulgaris can be Kardama Visarpa. At the same time, it can be in the Jwara also. At the same time, it can be in Avaranavata also. Dakodaranam, it is not only
Delegates, please do stay connected with our program. Sir has some network issue.
Delegate, kindly do wait in the program. Sir has some network issue. He will join soon. Delegates, kindly do wait. Sir will join within few minutes.
Delegates, sorry for the interruption. Sir will join soon. Please do stay connected with us.
Delegates, sorry for the inconvenience. Please do stay connected with the program. Sir will join soon. Delegates, sorry for the inconvenience. Sir has some net problem, so he will join soon. Please do stay connected with the program. Delegates, please to stay connected with the program. Soonly, sir will join.
Delegates, sorry for the inconvenience. Please do stay connected with us.
Delegates, sorry for the inconvenience. Please do stay connected with us. Soonly, sir will join. Delegates, sorry for the inconvenience. Please do stay connected with us. Soon, sir will join the session.
Delegates, sorry for the inconvenience. Please do stay connected with us.
Delegates, sorry for the inconvenience. Kindly do stay connected with us. Sir will join the session soon.
Am I audible now?
Yes, sir.
Okay. I don't know what happened in between. I was suddenly. Am I audible?
Yes, sir.
Yes.
Now it's clear, sir.
I was suddenly put out of the Zoom meeting, and again it was coming that the host is in another meeting. I don't know what happened. Shall we continue?
Yes, sir.
Yes,
Shall we
sir.
continue? Okay. Sorry for the inconvenience. Are the slides visible?
Yes, your screen is getting shared now.
Is it okay? Shall we continue?
Yes, sir. Please, the screen is shared now.
Okay. Now, this one. So we were discussing this slide. Again, in the screen, it is coming. Your screen sharing is paused. Is it moving now?
Yeah, it is passed. It'll come. I think that's network. Once it gets better, it'll come.
Okay, fine. Which is a slide which is shown in the presentation in your screen?
This Windows Explorer. That's what is coming right now.
Still,
It's just
once, has it started moving?
not yet.
Should I stop and again share the screen?
Yeah, you stop it and please share it again, sir. I think it will come.
Okay. Now?
Yeah, now it's coming. Yeah.
Okay. And let's continue. So the clinical presentations we were discussing about Shandhya, Andhya, Visarpa was being discussed. Visarpa was being discussed, and in that we were discussing about the possibility of Visarpa, where we have to interpret in the way like Grantija Visarpa in the line of lymphoid leukemia and Kardama, so on. So next is the Kodarana. We saw the Kodarana, not only the ascites, but related to the splenomegaly or hepatomegaly conditions, Vispota, or the sudden eruptive skin lesions which can occur in the form of pemphigus again, or in the form of drug reactions. And again, continuing with the Unmada related to the depression or psychiatric conditions. Such presentations are also to be seen here. Unmada, Bhagandaranam, the GIT manifestations which occur, the GIT manifestations which occur as Paraspara Hetavaha, like Arshas, Atisara, and Grahani are to be considered here, where the deeper tissues or deep Gambhira Dhatus are involved. And Murcha, Mada, Atmana, Galagrahana, Pandu. Pandu is not only anemia, Pandu is much more than anemia because Pandu is related to splenomegaly. Pandu is related to the systemic disorder, which can be considered as a junction to a lot of other illnesses. Amaya, Panduamaya, Amavisha Sejaiva, Amavisha, and Kilasa, Kushtagrahani, Amavisha we discussed earlier, and Shotha, again, acute inflammatory responses that occur in the patients as far as the external influences or because of Agantuja pathology itself. So these conditions are going on in tandem, in parallel to other clinical conditions. Again, if you see Santana Doshasya is again mentioned, which is considered to be the hereditary illnesses, hereditary conditions that can possibly occur in the person. Tathaiva Mrityu. Mrityu is the end phase. Viruddhanam Pravadanti Hetum. Am I audible? Am I audible?
Yes, sir.
Yes.
You are audible, sir.
Yes. And if you see the Gara, it mentions almost similar Lakshana. Pandu is there, Alpagnita is there, Jwara is there. Jwara and Shodha can be correlated because we cannot consider Jwara as only fever, but as a spectrum of disorders. Let us see when and how they can be interpreted when we discuss about the other factors. And this is Sushruta's reference. I will skip all of these slides because we have to go towards this autoimmune disorders. So after considering Gara and Dushi in this, there are few examples that we are about to discuss regarding the Virudha Lakshanas and autoimmune disorders. They can be the presentation or the stage which decides the exact placement where they have to be placed in our Samhitas, and the signs and symptoms are to be evaluated thoroughly, and their cause also. Triggering of an autoimmune response is usually seen in all the medical textbooks. If you see, the autoimmune disorders are triggering. They can be X or N number of factors, but no more solid Nidana evaluation is seen in those clinical conditions. But one thing is very evident in almost all these, the 6 or 7 disorders which are about to be discussed, have all one thing in common: the GIT manifestations with fatigue. And the role of Ojas and Agni are also to be considered. This is one common clinical condition that is taught in our clinics as well as in the OP. They are this gluten sensitive enteropathy. Their features are, major causative factor is eating gluten contents like wheat or barley, which triggers again an autoimmune response in the small intestine. It damages in over time, causing malabsorption. Amavisha causing over time the malabsorption features. Amavisha are to be considered again. And diarrhea, nausea, vomiting, fatigue, weight loss, all these features are again hinting towards the serious complications that can later be seen in the conditions of Grahani, infertility, malignancy, and osteoporosis. If you see the symptoms, unrelated symptoms to GIT, anemia, osteoporosis, dermatitis herpetiformis, these are the symptoms which are seen in the conditions of this gluten sensitive enteropathy. Now, this is absolutely the features related to Grahani and Pandu in this Lakshana. Tasya lingam ajirnasya vishtambha sadanam. All these features mentioned here. Ghoram anna visham chatat. I will keep on moving these slides this way. Anna visha is malabsorption, nausea, vomiting, diarrhea. All these symptoms are this one, Ghoram Anna Visham Chatat. And the underlined things, Mutra Rogam, Shchamutrastam, Kukshi, Rogan, Shakritgatam, Rasadibishya Samsrishtam, Kuryat Rogan, Rasadijan. If you see, Rasa to all the subsequent dhatus are affected. There has to be weight loss. There has to be genital tract infections. The patient may have, the patient may have hyposplenism. If you see, there is Pandu in the manifest, Pandu in it. Am I audible? Am I audible?
Yes, sir, you're
Yes,
audible,
sir.
sir.
Fine. I have not been put out. Again, this. The mouth ulcers, the neurological symptoms. In Vataja Grahani, there is a classical explanation of Vata Gulmam Udavartam Pliha Shankicha Manavaha. Vata Gulmam Udavartam Pliha Shankicha Manavaha. And this sort of stress or related to the neurological cognitive impairment, all these manifestations can be Grahani in one phase or other. Similarly, Pandu. Again, second condition which we are going to discuss is type 1 diabetes mellitus. If you see the features, glycosuria, dehydration, fatigue, polyuria, polydipsia, or genital tract or UTI frequently seen in the patients, blurred vision, weight loss, everything goes towards not prameha, but atistula santarpanajanya vyadhi. Why? Because in Sutrasthana itself, these areas are already covered in the chapter 21, 22. Santarpayati snigdaihi. This is where the patient is going to visit our OP. If you see, rogastasyopajayante santarpana nimittajaha. This is Sutrasthana reference where we find the patient with santarpana features, prameha pidaka, kota, kandu, pandvamaya jwaraha, kushta, amapradoshascha, mutrakrachram, arochakaha, tandra. If you see fatigue, see the fatigue, polyuria, polydipsia, all these are mentioned not in prameha but in the santarpanotta vikara, as well as atistula lakshana, atistulasya tavadayusho hrasaha javoparodaha, daurgandhyam, daurbalyam, swedabadaha, all these krichravyavayata, everything is mentioned in santarpanotta vikara pathology. So, kushtani, amapradoshascha, mutra krichram, arochakaha, tandra, klaibya, atisthaulya, alasya, gurugatrata, indriya, srotasam, lepo. See how beautifully he mentions about blurred vision. Indriya, srotasam, lepo. Buddher, moha, pramilakaha. What is pramilaka? Pramilaka means satata pradhyanam. The patient will always be anxious, always be thinking, always be unsettled, always be undecisive in his life. So such psychological impact is also there in the case of Santarpanotta Vikara. Treatment has to be targeted in this line, not in Prameha. And there are a few classical examples where the cases of diabetes mellitus or a hepatic disorder can be brought together. There, the samprapti has to be shifted to Dushi Visha or Garavisha. Now, rheumatoid arthritis. What about rheumatoid arthritis? Here, in the cases, if we see, I have all kept it in the bold. Polyarthritis, pitting edema, morning stiffness, acute onset, relapsing and remitting pattern, fatigue, Baker's cyst and nodules, cardiac, pulmonary and ocular manifestation. Where we have to see in Amavata? No, not in Amavata obviously. We have to see in Jwara and Gambhira Vata Rakta many times. Why Jwara? This is why Jwara is very relevant in the condition of, in the management of Amavata. Am I audible?
Yes, sir. Yes.
Sir, audible.
Yes. And see, the case is coming here in this area. See the Lakshana, how beautifully he has mentioned. All these are underlined. Hina Tejasam is one. Swalpena pyapacharani tasya vyavartate punaha. Apachara can cause, see, the relapsing and remitting pattern, not in Amavata, but in Jwara. Athava api paripakam dhatushveva kramanmalaha the dhatu pradoshaja vikara, and the mala is getting affected here, and there we have to target the management of jvara. Dinatam, shvayathum, glanim, pandutam, na anna kamatam, kandu utkotapidakaha, where in the conditions of skin manifestations of rheumatoid arthritis, especially psoriatic arthropathy, as well as in the RA cases where Gambhira Dhatu is involved, Jvara is the target. Kurvanti, Agnim cha, te mrudum, eva manyepi cha gadaha, vyavartante punargataha. Such disorders will keep on tormenting the patient again and again in spite of management, if it is half done or if it is improperly done. Yatha pranam hare dosham prayogairva shamam nayet mrudubihi shodhanaihi. Now comes the relevance of where all mrudu shodhana is to be done. There the concept of jvara goes on developing. Here what we have to take the message is not always the RA can be considered as in Amavata, but these all manifestations, cardiac, pulmonary, ocular. If you see Jvara Chikitsa, he mentions Jvara with Kushta, Jvara with Shwasa. Individual symptom manifestations with the Jvara is mentioned very beautifully in Charaka Samhita, and management is also different. So RA, we have to keep Jvara as well as Gambhira Vatarakta in mind. Now comes psoriasis and psoriatic arthropathy, erythematous plaque, bleeding points, whatever lakshanas we see, it is Virudha, Dushi or Vatarakta. Now comes the involvement of Dushi Visha here. In Dushi Visha, Charaka mentions Dushi Visham tu Shonita Dushti, Aruhu, Itibha, Kotalingam cha. This may seem one single line for us, but it is not a single line for a clinician. Dushi Visham tu Shonita Dushti, Aruhu, Hitibha, Kotha means 4 spectral disorders. Shonita Dushti is what I mentioned in the first slide. If you remember, the Shonita Jaroga mentioned in Charaka Sutra Sthana 24th chapter, that is that single word in Dushi Visha, Shonita Dushti. Aruhu is Vrana. Why Vrana is very relevant? Because Vrana and Dushi Visha are interrelated, as the whole Visha Chikitsa is only a single branch of Shalya Tantra. If you see Sushruta Chikitsa Sthana Dvivraniya Chikitsa, out of that Shashti Rupakrama, out of those Shashti Rupakrama, one is Vishagna. There we have to interpret in this way that when a patient comes to us with the Vrana, there can be possibility of a skin disorder, which is again can have Visha as a Nidana. That is the relevance of Aru. That is not only single word ulcer. Kitibha. Kitibha is a depicture, is a Murti Bhava of a chronic skin disorder, while Kotha is a Murti Bhava of an acute skin disorder. This much big dimension is there in that one single line of Dushi Visham tu Shonita Dushti Aruhu Kitibha Kothalingam cha. So invariably we have to consider that waxing and waning features, may it be in the gutted psoriasis where Vata Kapha is predominant, erythrodermal psoriasis where Pitta and Vata is predominant, and pustular psoriasis where Pitta and Kapha are predominant. That is why in Ashtanga Hridaya as well as Charaka Samhita he mentions Nacha Eka Doshajam Kushtam Nrananam Samupalabhyate. There is no case who comes in front of us with psoriasis who comes because of single dosha involvement. Gutted can be compared to a case of Vata Kapha predominance. Erythrodermic can be compared to Vata Vaitika predominance, and pustular can be considered to be Pitta Kaphaja predominance. Everywhere we have to consider it under Virudha, Dushi or Vatarakta, not only Kushta. Now comes multiple sclerosis. It's always a pleasure to build a Samprapti, because Samprapti development is like building a home. If the foundation is perfect, now the Samprapti can go on beautifully. Its lintel work will go on fine. Its roof work will be perfect. The end result will be a totally beautiful house. How multiple sclerosis is to be brought? 2 or more relapses or affecting different parts of nervous system. Jvara, numbness and weakness in one or more limbs, Vata Rakta, rapid stroke-like presentation, very delayed progression in Vata Vyadhi, rare fulminant type with instant death, Virudha, optic neuritis, Virudha, sensory symptoms in the line of Gata Vata or Avarana Vata, sixth nerve palsy in Vata Vyadhi, recurrent facial palsy, trigeminal neuralgia as Trimermia. So wonderfully coined Samprapti pattern in these Sutrasthana and Marma Bhigata Janya, Pakshagata or the Trimermia Chikitsa. Their Panchakarma is inevitable. No treatment is complete without Panchakarma. So that is the relevance of such conditions where we have to see in all these disorders. When I told about Vata Vyadhi, when I discussed about Prameha, Vataja Prameha, when we discussed about delayed or acute presentation in Virudha, everywhere Ahara is one of the factors. Rare fulminant type with instant death. We discussed Vishavat Sadhyo Nashakatvat. Optic neuritis, Andhya is one word mentioned in Virudha. So these are all having relevance with the Ahara or the manifestation of Samprapti in Virudha or Annavisha. But the disease presentation need not be seen all symptoms together. Patient may come to us with these one or two symptoms. That is why multiple sclerosis and SLE is usually skipping from our mind when we sit in our clinic. So these sort of presentations cannot come all together. That is why reading textbook and sitting in a clinic are entirely different. In a clinic, a patient comes to us with fever, weight loss, lymphadenopathy, and joint pain. We will start thinking about Amavata. We will start thinking about Vata Rakta, but we will forget about systemic lupus erythematosus. By thinking those things in mind, we have to think about Visarpa again. So in Visarpa, why Visarpa? In Virudha, we learnt a word Virudha and Visarpa together. I will go back to that slide. See, Shandya, Andhya, Visarpa. SLE can be brought under that single word. Vispota can be brought under single word. Unmada is again a very big area wherein Charaka Chikitsasthana 9th chapter, he mentions about Viruddha Dushta Ashuchi Bhojanani. Viruddha Dushta Ashuchi Bhojanani. Dushta, he mentions, Chakrapani mentions, Atyantam Kalusham Garado is the Chakrapani commentary mentioned for Dushta. So the dimension of the author Charaka and his commentator Chakrapani has been entirely different than what we read the textbook today. See, Unmada, very coined word in Visarpa, in Virudha he has mentioned, but definitely Unmada is having one relation to the one or other relation, because in many of these conditions there is a psychological involvement, cognitive impairment or seizures, or may it be here in Vataja Grahani, where the patient may go for Vata Gulma Mudavartam Pliha Shankicha Manavaha, or in the case of Vataja Prameha, and in Santarpanota Vikara, Pramilaka, everywhere Unmada is not the simple word of psychiatric illness. Satatam Pradhyanam is a depressed patient, a frustrated patient because of constant intake of medicine and not finding any result. All these are to be interpreted from the body language of the patient. From the body language of the patient. He may come to us by a total frustration. It cannot be considered as the patient, we cannot say that you are very angry and write prescription in the line of our conventional management. There has to be one or the other element of Virudha in all these conditions. Jwara we discussed, psoriasis we discussed, multiple sclerosis. And here, multiple sclerosis, I am lucky enough to have 3 patients managed in the line of Visha, for multiple sclerosis, and by God's grace or by Visha Samprapti, which hit to the target, all are healthy and all are driving also. Now they are independent vehicles, they are driving. But only thing is, they have to take medicines lifelong. And systemic lupus SLE, similar presentation. Visarpa, I already told the presentation. Tata shoditaja rogaha prajayante pratakvidaha. Here, if you see, this is from Charaka Sutra Sthana 24th chapter, where the presentation of Shonitaja Roga. Why? Because it has a direct involvement of Rakta, thereby direct involvement with Virudha, Dushi as well as Gara. All these are Visha, and every Visha directly affects Rakta, thereby causing effect over the subsequent Dhatus. This is a rule. In Visha, first involved Dhatu is Rakta. Then only it goes towards other Dhatu. Now, keeping this thing in mind, let us see how this shloka can be interpreted in a patient. See, am I audible?
Yes, sir.
Thank you. See, Vaivarnya. Vaivarnya is not simple discoloration. His ojas also has to be considered. Agnisadascha, appetite is reduced. Pipasa, Gurugatrata, Santarpanota Vikara, Santapascha, Ati Daurbalya. Ojas is involved. Fatigue syndrome is there. Shirasascharuk, Urdha Jatrugata Vikara is there. Bidahascha, Annapanasya, Tikta, Amlodgiranam Klamaha. If you see that gluten related sensitivity, or if you see Crohn's disease, everywhere, all these presentations are hidden in shloka. Only thing is that we have to find it. Madaha, Kampaha, Swarakshayaha, Indriya Daurbalyam, Vyadhim, Indriya Daurbalyam, Swarakshayaha, Sharira Daurgandhyam, the patient of Prameha, the patient of Prameha Pidaka, the patient with a chronic ulcerations, multiple ulcers coming to our OP, Tandra, Nidra, Ati Yogascha, Tamashaschati Darshanam, the sudden onset of patient going to coma immediately. Kandu, Aruhu, Kota, Pidaka, dermatological manifestations of autoimmune disorders. Charmadaladayaha, erythrodermal psoriasis. Vikaraha sarva evaite vijnaya shonitashraya. See, one presentation, one lakshana in a common shloka can indicate one disorder. Or out of this, we can pick 4 or 5 symptoms from this shloka and we can see one disease, one presentation in a patient. This is how we can interpret a disorder from a single shloka. IBD. IBD is Grahani, nothing else. Together with Grahani, Trivida Kukshiya and Paraspara Hetavaha forms IBD, ulcerative colitis and Crohn's. There are all these features: diarrhea, fever. Now, fever, if a patient comes with fever and diarrhea, it need not always be a case of fever induced diarrhea. It can be food poisoning. If it is chronic, now suspect about IBD. What if it comes in a small child? The dimension changes. Fatigue, anemia. If these 6 clinical conditions which we discussed, everywhere there was diarrhea, fatigue, anemia, abdominal pain, and mouth ulcers, reduced appetite, weight loss. Everywhere these features were there. If you see the inflammatory changes, eyes, skin, joints, and liver, everywhere the patient will have uveitis. The presentation can be uveitis. The presentation can be eczema, or the presentation can be non-healing ulcers. The presentation can be joints. But we forget to ask one question about his GIT, to link his joint condition with the Grahani, his hepatobiliary system involved with the Grahani. One question is enough. Do you pass stool soon after taking food? If the answer is yes, now our Saprapti goes towards other side, not towards Samavata, but towards Grahani. Now joint pathology can be interpreted in this way also. Delayed growth and sexual development. In Virudha, we discussed about Santana doshasya tathaiva mrityum. Santana dosha, the delayed growth, sexual development. There also the involvement of Virudha is there. Now it is our duty to fix that particular clinical group of symptoms presented in the patient, whether the similar lakshanas which we discussed, if it is related to delayed growth and sexual development, whether it is IBD, whether it is related to Virudha, and if not, the same sexual development or delayed growth is seen in other clinical condition also, just like we discussed in Vata Prameha. Here all genital tract infection related infertility patient coming to us, we see the patient is diabetic and he is having weight loss. Now all diabetic cases cannot be brought under Atistula. So Vata Pramehi can also be there. Infertility is there. Now our area changes, our Samprapti changes. Here, see, learning disabilities, ADHD, delayed puberty. In the case of gluten sensitive enteropathy, everywhere the symptoms are similar, but our Samprapti changes and our chapter to search where this patient has to be placed changes. Now, Trivida Kukshiya Vimana is inevitable while we discuss about Virudha. Trivida Kukshiya Vimana, Charaka Vimanasthana. Every Samprapti begins from there. May it be Grahani or Paraspara Hetavaha concept. Harsha, Atisara and Grahani directly correlates to IBD. So it is our duty to see Harsha, Atisara and Grahani are because of Pandu. Again, Pandu Samprapti also has to be considered in the case of Grahani. Similarly, we can find Addison's disease and Prameha, Addison's disease and Vata Vyadhi, Graves disease and Atikrisha and Langhana Brahmaniya Adhyaya, Jogren's syndrome and Trishna, Myasthenia gravis and Grahani, Myasthenia gravis and Vata Vyadhi, Myasthenia gravis and Jwara, vasculitis with Vata Rakta, vasculitis with Ashayapakarsha Samprapti, vasculitis with Visarpa, and finally vasculitis with Raktapitta. That we do always. Vasculitis, we think of Raktapitta and start treating, but not always. It can be Ashayapakarsha, it can be Visarpa, it can be Jwara. Again, I will skip the slide and you see vasculitis in Jwara. I will show the Lakshanas. How our textbook is a treasure. See, Kandurutkota Pedakaha, Kandurutkota Pedakaha, Pandutam, Shwayathum. Is Shwayathu only swelling? No. Shwayathu is not only swelling. If you see Charaka Sutrasthana 18th chapter, Shwayathu is much more than that. Shwayathu can be found in Jwara. Shwayathu can be found in Vatarakta. Shwayathu can be found in Prameha. And Shwayathu can be found in Vata and in vasculitis also. Kandu Utkota Pedakaha. You remember this Kandu Utkota Pedakaha and also Dinatam, Na Anna Kamatam and Glani. All these words you please remember. I think the time is up. Now how to approach is again, let us skip that. You see this shloka. How to do Shodhana. Abhipako, Aruchihi, Staulyam, Panduta, Gauravam, Klamaha, Pidaka, Kota, Kandunam, Kandurut, Kota, Pidakaha. Pandu is there, Gaurava is there, Klama is there. We discussed in 4 or 5 Lakshanas where Klama was one of the symptoms everywhere. Tandra, Clypia, Abuddhitvam, indecisiveness, decision making is affected. Ashasta Swapna Darshanam, Bala Varna Pranashascha. These are all the indications for Shodhana in Charaka Sutra Sana 16th. If we see it as an independent factor, we can have much more things coming out of this shloka. These are all symptoms. If you see in a Virudha, Ahara or Gara or Dushi Visha pathology, these Lakshanas, Avipaka is there, Staulya is there, Aruchi is there, Panduta is there, Gaurava is there, Klama is there. Now it is Rasa Pradosha Javikara. Straightly go about, think of Jwara, Rasa Pradosha Javikara, think of think of prameha. Pidaka, kota, kandunam, think of vasculitis, or think of SLE, Rakta Pradosha Javikara, Sambhavo Aratirevacha, Mamsa Pradosha Javikara, Alasya, Shrama, Daurbalya, Alasya, Shrama, Daurbalya, Daurgandhya, Avasadaka, Medo Pradosha Javikara, Shleshma Pitta Samuklesho, Nidra Nasho, Ati Nidrata. Now think of Asti and Majja. Tandra, Klaipya, Abuddhitvam, Ashasta Swapna Darshanam. Think of Shukra and Ojas, Balavarna Pranashascha. Ojas is lost. Now this is a direct indication to assess Rasa to Shukra and Ojas and to decide whether that person can be fit for Shodhana Karma. This is from Sutrasthana, and he has gone to another level of thought. To decide Shodhana, these are to be seen as Lakshanas. If our patient who is in front of us has these Lakshanas and he is fit for Shodhana, do Shodhana. Why to do Shodhana is what is seen this pattern. There is a pattern in the management of Virudha or any other symptoms. Viruddhashanajan rogan pratihanti virechanam vamanam shamanam chaiva purvam va hitasevanam. Every disorder can, we have a choice whether to do Shodhana, Shamana or Rasayana. Here we have to do everything. And if you see in Dushi, again Dushi Visharto Suswinnam Urdhvamcha Adasya Shodhitam. Again Swedana is there, Vamana is there, Virechana is there, Dushi Vishari is Rasayana. And if you see Gararto Nasham Apnoti, that is there, Maranam Cha Adhigacchati from our first slide. Nasham apnoti. Now, what about the treatment about in Gara? Gararto, Vantavan, Bhuktva, Tat Patyam Pana Bhojanam. Again, Vamana is there. Pathya, Pana Bhojana is there. So, every condition where there is Amavisha or Annavisha, Shodhana is there. Shamana is there. Pathya is there. And Rasayana has to be there. So, every clinical condition related to Viruddhahara is related to Gara, is related to Dushi, is related to Shodhana and Rasayana. That is the relevance of this shloka. Now, I know I am running out of time. 5 minutes more. How to select a medicine. Kalyanaka Grita is there. If you see, all these autoimmune pathology lakshanas are there in Kalyanaka Grita. Once you decide Shodhana is to be done, think of Kalyanaka Grita for Snehapana. Or you want a Rasayana in a regulated dose, we can give Kalyanaka Grita. If the case is Vata, Kapha, Shara Prayoga. Again, in Gara, there is Shara Prayoga. In Visha, there is Shara Prayoga. Can we give? No, if it is Kapha predominant. In the form of Ksharagada. Now see the indications of Ksharagada. Isn't it the same thing that we have discussed in the 7 autoimmune conditions that we discussed and the 7 clinical conditions that I showed in the slide? Jwara, Pandu, Visarpa, Twagdosha, Bhagandara, Liha, Shotha, Apasmara, all these Lakshanas. Everything is there in this. Bilvadiyagada. I will share the slide to Hari sir. You can please go through this. Interpretation is there. Even I need not tell that. All these areas are covered in it. Anupana, Tulasi Swarasa, Ardaraka Swarasa, everywhere we have a management option. Vishavilvadi, Taruna Bhaskara. On all the conditions of multiple sclerosis, I had prescribed this Taruna Bhaskara Agada. These are the ingredients. And the interpretation I have written in this. Savishagada, Vatakapashamana, everything is there, self-explanatory. Murvadi is a good Amapachana. Tushi Vishari is a Rasayana. Dashanga is a Shamana, Aushada, in the conditions of Pitta predominance is seen. Interpretation is there. Tapyadi Loha, we know Tapyadi Loha is available in the market. We write Tapyadi Loha for Pandu, but not only Pandu. In which area of Pandu or autoimmune disorders it is there. Pandu together with Visha, together with Yakshma, together with Jwara, together with Kushta, together with Meha, together with Shobha. See, all those autoimmune pathology lakshanas are seen in a single yoga of Tapyadiloha. But we write Tapyadiloha in Pandu. But which Pandu, which stage of Pandu is to be seen? Asanadi Gana Kashaya is there in Ashtanga Hridaya Sutrasthana 15th chapter. Asanadi Gana is there. It is a very good Shodhananga Kashaya, very good yoga in the autoimmune disorders which we can think of, where Kleda is predominant factor. Aragvadadi Gana, where Kapha is the predominant factor, and it is in Pakwa Shayastha condition, clinical condition. Abhayarishta, we write Abhayarishta for hemorrhoids, but it is not only hemorrhoids. There is much more for Abhayarishta to do. It has a lot of work to do in our OP or in our IP. Grahani Pandu Hridroga, Pliha Gulmodarapaha, Kushta, Shobha, Aruchi Haro. Now the last line is very, very important. Balavarnagni Vardhanaha. Now I need not tell when all we discussed Balavarnagni, chronic fatigue syndrome. We discussed fatigue. We discussed about the tiredness. We discussed about ojas. Balavarnagni Varna, the yoga is in our clinics. Abhayarishta is there. Yoga Raja Churna, Pandu, but Rasayana Midam Shreshtam, Sarva Roga Haram Shivam, Sarva Roga Haram Shivam. Grammar is there in between. Sarva Roga Haram Shivam, Rasayana Midam Shreshtam, Sarva Roga Haram Shivam. Now next yoga, Sarva Roga Haraha Shivaha. Last line. Sarva Roga Haraha Shivaha. If time permits, in other discussion, we will see in a same chapter in two yogas why Haram Shivam, Panduroga, Visha, Kasa, Yakshma, Vishamajwara, Sarva Roga Haraha Shivaha. This is second yoga, immediate. You see the shloka number 82 to 92. Continuous shloka, same word in a different grammatical presentation. Has a relevance in autoimmune disorders, has a relevant for the stage to be relevant, stage to be prescribed. All there. Punaravartaka Jwara, I already showed that Jwara shloka. This is a very, very good yoga where Swalpena Pyapacharena Tasya Vyavartate Punaha Samprapti in a recurrence, relapsing sort of conditions. We can opt this as a first yoga. Kottam Tagaradi is one yoga which I usually write for SLE or Pitta predominant, where I consider the case as Visarpa or Vatarakta. Many times it backfires, but still it is a very good yoga. Together with the Punaravartaka Jwarahara Kashaya, of course. Punaravartaka and Kottam Tagaradi can be written together. Kleda Shoshana and Vyadishamana we can get together. Nalpamaram. Panchavalkala Kashaya internal administration for Amavata if we suspect Dhatu Poshana Nyaya, Dhatu Poshana Krama is involved in a disorder. Think of Nalpamara internally, because Meda, Asti and Majja transformation is best possible when we think of Nalpamara internally. Thank you. Over to the organizers. Over to the organizers.
Thank you, sir. Thank you very much, sir, for taking your time to prepare for us such an extraordinary, wonderful presentation, which was incredibly informative. We are running out of time. We are quitting question answer session.
Okay, fine.
Thank you so much, sir.
I interrupt. Sorry to interrupt. First of all, I am extremely sorry that not because of my reason, I think I got out of that presentation. So I request the participants to please mail your queries to the organizers. I will reply through mail. I will reply through mail or even through WhatsApp. No problem. I will reply to all the queries which have come today.
Thank you, sir.
Okay. Okay. Thank you.
Thank you very much, sir. Now, let's move on to the next session for the day. In this session, we will be dealing with Ayu Emergency Care Project by Dr. Mellitus, who is a medical doctor from France. Sorry for the interruption. Delegates, sorry for the interruption. Now, I request Dr. Geetu Mohandas, Assistant Professor, Swasta Department, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Okay, thank you. Am I audible?
Yes, ma'am.
Let me thank Dr. Gopi Krishnan. On behalf of Ayurveda College Coimbatore and Team DIKSHA, it's my privilege and great joy for me to extend a vote of thanks for today's section. First of all, I would like to express my sincere gratitude to Dr. Gopi Krishna S., Assistant Professor, Ayurveda College Kottakkal, for sharing his valuable experience and views on the role of Virudha Hara in autoimmune disorders. Thank you, sir. Thank you so much. I extend my sincere gratitude to all those who are behind the screen, especially our beloved principal, Dr. Chandramouli sir, Dr. Tulya ma'am, Dr. Ananta Shai, who are the pillars of our webinar series. I extend my sincere gratitude to whole DIKSHA team for providing us with the best virtual platform. Last but not the least, let me thank all our delegates who have responded so well for our invitation and made it a grand success. We look forward to welcome you again in our coming sections. Thank you all.
Thank you, ma'am. Now, let's move on to the next session for the day. In this session, we will be dealing with Ayu Emergency Care Project by Dr. Mellitus. Is a medical doctor from France, MD, PhD in emergency medicine and anesthesiology, specialized in emergency care, mountain accident and disaster management until 2016. Director of Training Center of Emergency Care, Assistant Director of the Department of Mobile Emergency and Intensive Care at CHM Government Hospital, Mayotte, French island between Africa and Madagascar.
Good evening. Thank you for the presentation. I really thank all the participants to come to this session and the organizing team of SAMSIDDHI, Dr. Tulya, Dr. Chandramouli Shwaran. And I will start with to share my screen. So thank you to Dr. Gopi Krishnan to show us how Ayurveda can handle very difficult disease if we go deep in the text and if we practice a lot. So I will share with you this project, Ayu Emergency Care Project, who start in 2017 with the team of AVP Research Foundation, and is supported by Ministry of Ayush. Am I audible?
Yes, sir, you're audible.
Okay. First of all, I would like to thank Padma Shri Krishna Kumarji to make this project possible, because he initiated this project and always support our team to to go on. It's a difficult path to join emergency and Ayurveda, but all the time the way was clear and we can go on. I really thank the team of AVP Research Foundation, Dr. Sumit Kumar, Dr. Arun, Dr. Sujit, and all the team. So this project has different branches, and we went step by step. The first step was to really evaluate if Ayurveda community need a training in emergency and how to handle it and what are their expectations. So the assessment was done through a survey, online survey, during 2019-2020. And we had 855 participants, UG students, PG students, practitioners, and teachers. And about them, 50% were exposed to common emergency. That means external bleeding, loss of consciousness, heart attack, delivery, acute dyspnea, road accident, burns, fracture and dislocation, acute infection disease, psychiatric emergency. About them, the sense of confidence was not so high, only 30%. And when we talk about heart attack, it was only 16%. Almost everyone says that they need more training in emergency care. And one answer was surprised me a lot. 90% of the participants said that Ayurveda can treat or be part of the treatment of an emergency situation. This opened a large door for the research in Ayurveda and in emergency. The second branch is, if we want to create a training, we have to follow first a training available and with international guidelines, and to join the rescue chain already in place. So we focus on what is the more adapted training from the allopathy community. So it's an ACLS. It's a comprehensive emergency care and life support. It follows international guidelines. It's about only life-threatening situation. It's practical, hands-on. It's in 4 days. And BLS certification is included. And the cost is very, very reasonable. So I went to talk with the team who can handle and train ECLS, and they are ready to train ECLS to Ayurveda doctor. And already they have done it. The problem is we need to have TOT, training of trainers. So for the Ayurvedic community to be independent, autonomous, and can train all the BAMS and the Vedyas on this training. But at this time, this training is not allowed for Ayurveda doctor. So we are working on to know how it can be possible, because if we want this training sustainable, we need a team of Ayurvedic doctor to train and to spread this training. So this training is really practical. It teaches you how to save the airways, even endotracheal intubation, in a really concise manner and practical. You will practice it many times, so you cannot forget, and when it's really necessary, you can do it. Even cricothyroidotomy. So in an easy way, safe way, even you practice it. After simple practice, but who can really save life, choking, how to practice on adults, how to practice on infant, child. So now I would like everyone to close your eyes and try to imagine a situation where you have just passed the BAMS, you are graduate, and to have a more experience, you choose to be posted in a primary health care hospital in a remote area, and you are on duty. It's 9 o'clock in the evening, and you are the only doctor in the casualty. And the nurse come to you saying, there is a 44-year-old man who got struck by a speeding car. On arrival at the hospital, the patient is moaning in pain. The vitals are the BP 92/60, the pulse 126, the rate respiratory 26, the temperature 37, and the SpO2 88. The man responds only to painful stimuli. So if you can now, you can write on the chat and say what you will do. What can you do if you receive someone like this and you are alone with some people, but how to handle it in a safe manner? I don't know if you can access the chat, but if everyone can just answer any answer from what you start, where you are looking, the vitals are normal or not, it is a critical patient or not. If anyone can share, so we can have a more interactive session. No one can guess what to do with this man. So he's almost unconscious because just responds to painful stimuli. And the vitals are not so good. So, okay, I don't know if you can answer or not, and no one answers, so I will go on. So this training will give you an idea how to really manage this person. So with really easy algorithm, like for traumatologic patient, it's HABCD. And the first thing is to control the massive hemorrhage. If the blood is there, we have to stop the blood. And after we go to the airway and the breath. So this is not theoretical. It will be in practice, hands-on, with simulation and scenarios. So different technique you will learn: direct pressure, pressure dressing, even tourniquet. If you don't have tourniquet, commercial tourniquet, you can do this with dupata and one stick of wood stick. So it will be very easy to focus to stop hemorrhage. Then you come back to your algorithm and you go to see the airways. So you have practiced the airways. You can safely intubate the patient and have the airway open and safe. So you can oxygenate. And the last thing you can go, the goal of this training is to stabilize the patient everywhere you are with simple methods and less material, and to transfer to the higher healthcare hospital. So even there, one technique.
This video will demonstrate needle decompression of a tension pneumothorax. Needle decompression should only be performed on patients exhibiting signs and symptoms associated with a tension pneumothorax. The first provider assists the patient's ventilations as needed with supplemental oxygen. The second provider auscultates the patient's chest and confirms decreased or absent breath sounds or signs of circulatory impairment. The second provider assembles the equipment for needle decompression, which includes a large bore over-the-needle IV catheter between 10 and 14 gauge in size, and at least 8 centimeters in length, a syringe, tape, and antiseptic swabs or solution. While the first provider continues to assist ventilations, the second provider locates the patient's mid-clavicular line at the second intercostal space on the affected side and cleanses the site with an antiseptic solution. The provider stretches the patient's skin over the site between the fingers of his or her non-dominant hand. With the syringe attached to the needle, the provider inserts the needle over the top of the third rib. Once the needle enters the thoracic cavity, air will escape into the barrel of the syringe. The needle should not be advanced further. The catheter should be left in place and the needle removed, being careful not to kink the catheter. As the needle is removed, a rush of air from the hub of the catheter may be heard. The catheter should be left in place to indicate that needle decompression of the chest was attempted. The chest is auscultated for improved breath sounds, and the catheter is secured in place. Needle decompression may need to be repeated if the catheter becomes occluded with a blood clot and tension pneumothorax recurs.
So this example is just to tell you, even you have a patient who has an accident with motor, and he comes to you with simple things. If you can diagnose pneumothorax, tension pneumothorax, you will learn it in this training. With a simple syringe, you can just stabilize him until he will go to a casualty of a higher hospital. And you will, in 4 days, you will practice management of cardiac emergencies, respiratory emergencies, trauma, burns, obstetric emergencies, neonatal resuscitation, pediatric emergencies, and toxicology. So now it's almost 1 year we searched the good training for Ayurvedic doctor. Now I think we found it. We have to manage legal aspect and ethical aspect and political aspect to really start this training and provide this training to every Ayurvedic doctor and BAMS who want. And I think for the rescue chain in India, now even WHO just count the MBBS doctor, 12 lakhs. But if we add in this rescue chain 7.7 lakhs of Ayush doctor, it will have a great impact in the public health. And now in 2021, not every MBBS are trained at this level of ECLS. So it's probably the good time to include Ayush doctor as an active provider in the rescue chain. Even Dr. Abdul Kalam said, train one in every family in emergency care. So, or from my side, I think any Ayush doctor has to be trained to be more confident to face any emergency. The third branch is we cannot stay with ACLS training because it's management of emergency, but from the allopathic side. We can create an AECLS. This it will be in the future. So we start with the ECLS training and then work with the institution who provide ACLS and create AECLS, because most of the case you don't use much drug from allopathic side. It's common sense, it's practical, it's technology. Even intubation, it's not allopathic. Intubation is the technology give the support to put a tube and open the airways. So the same for the tension pneumothorax. If you diagnose tension pneumothorax, very easy. In fact, when you are in front of a patient, you put a needle and you save him. So we need this ACLS to be created, and the TOT, the training of trainers. This ACLS will be for Ayur doctor or interns. It has to be almost the same syllabus as the ACLS, but we have to do some modification for the legal aspect and ethic rules about which drug we can use from allopathy in emergency. And it can be explained with the Ayurvedic principle and the modern science, but you can really have the thought process of Ayurveda and explain what's happened and why we do this management. And I'm sure a lot of explanation with Ayurvedic principle can match. The goal of create this training and have the training of trainer is to make this training sustainable. You cannot depend full time on MBBS doctor to train. They are really busy, a lot of work to do with allopathic community. So one time you receive the AECLS training, you will practice, and you maybe a few weeks after or a few months after, you can come to the TOT. So you will become trainers, and step by step they will be senior trainers, and so everyone can at one point become trainer. This training will be a very high quality training for your doctor and to recognize critical illness and provide care. Yeah, in the one good sentence from the MBBS training team, it was, what I see, I remember, what I practice, I understand, what I teach, I know. So to have this combination of AECLS training and TOT, it can really improve the quality of the management of emergency care. So for this, we will need cooperation and co-creation for efficient training and research project between Vedyas and Ayurvedic institution, between trainers and researchers from allopathy community, from Ayurveda community, and from social science and humanities. They observe well, they really know how we can communicate and cooperate. And this cooperation will be developed between India and different countries, because you have different medical system in India. It's a very unique place, and this can work. And if it's work, it can give a lot of input for the other countries to accept the medical system they now don't accept. To start this creation and cooperation, we need a really strong team, an IU emergency task force. And in 2020, it was a great web conference with many Vedyas who share their practice and their experience about critical care and Ayurveda. And I think there is much more in India, and all this master can really give guidance and help to create this training. Even recently, I follow a conference by Dr. Ashwat Rao, who really shared his experience. It's a allopathic surgeon and treat a lot of cases, even in ICU, with Ayurveda, because he became from an Ayurvedic family, and he has a lot of results. So in different places, we can see Dr. Jyoti Joshi, who studied potential for supportive Ayurvedic care in hypoxemic COVID-19 patient with good result. And Ayurveda co-intervention have supported complete recovery of severe COVID-19 infection with a chest severity score 19 to 25. So I think your generation now can really talk to the allopathic doctor, and even if it's critical case, Ayurveda can act with the support of allopathy. And this can be really explored, and my feeling is you will have a very great surprise. At that time, when you start to cooperate or do integrative study, or from my side, I was wondering what to do, how to do this research. I'm not from India. I have not the same background. I'm not from Ayurvedic community. And so I don't want to harm and to impose my thoughts or my vision. So I start to read a little about social science, and two concepts I would like to share with you. So it's cognitive justice. Democracy as a theory of difference has to recognize not the universal validity of science, but the plural availability of knowledges, that no form of knowledge can be forcibly museumized, and that memory and innovation intrinsically go together. The dialogue of the science of East and West need no longer be conducted across the old dichotomies of tradition and modernity, of development and underdevelopment. Nor can we survive on the categories the West provides us in terms of democracy, property, or rights. We have to invent words in English to say what the West cannot. This comes from Professor Shiv Vishwanathan, Director, Center for the Study of Knowledge Systems, India. And this is really, really relevant. And I think any student of Ayurveda really need to be aware of the background of India and to know each foundation. Don't jump directly to modern science, and it will be a big struggle. So this can be an help, but first you have to be very strong in Ayurveda with the philosophy who support Ayurveda and the science. So this cognitive justice, for me, it's a really nice concept, and it comes from India. It's not from everywhere. Epistemology of the South, it's another concept, and it's not the geographical South. It's in response to the epistemology of the North, of the West, because we can see now the modern science doesn't allow other knowledge to take place if we don't follow the rules of modern science, the epistemology of the North. So some researchers from different countries in the world create these epistemologies of the South to say there is different vision, different system, different vision, and this is the pluralism. We cannot just follow one vision of the world. So as a collection of knowledges born of and anchored in the experience of marginalized peoples who actively resist capitalism, colonialism, and patriarchy, epistemologies of the South represent those forms of knowledge that are generally discredited, erased, or ignored by dominant culture of the global North. Noting the declining efficacy of the established social and political solution to combat inequality and discrimination, global justice can only come about through an epistemological shift that guarantees cognitive justice. This comes from Professor Boaventura de Santos, University of Coimbra, Portugal. And he worked with the University of Wisconsin-Madison, US. And he has written very good book about in different parts of the world, medical system who cannot be recognized because they don't speak the same language as the modern science. And he tried to found a methodology, different system to bring them in the recognition and recognized by the world. So it's really inspiring. I ask you if you can to read some article from Boaventura de Sousa Santos. I will share some link. The fifth branch, it's now we know for the training and for the research we have to cooperate, allopathy community and Ayurveda or Ayush community. But how to cooperate now? Even last year, even at the beginning of the COVID, lot of tension, lot of political issue. You have the right to treat or not. The surgeon of Ayurveda are recognized as the right to do some surgery or not. All this is difficult. And for this cooperation, we need a platform, a safe platform to create training and guide for publication on Ayurveda and critical care. If we take the subject of rescue chain, but it can be any subject you want to do research in Ayurveda. If you will cooperate with biomedicine, because even you want laboratory reports or different scans, or you will think you work with biomedicine. In this field, we need a third place, safe place, who promote cognitive justice. If we take the example of ACLS, emergency care and life support, from the allopathic side, and we want to create an AECLS, we really need to communicate, cooperate with them, and found a good solution and acceptable for both sides. For this, a safe platform for transdisciplinary research team with researchers from ethics, epistemology, epidemiology, biomedicine, Ayurveda, philosophy, history, can meet on one subject and really think how we can handle it and have a horizontal communication, mutual understanding, respect, and cooperation between different medical systems. This third place could work as a moderator. It will be a linguistic challenge. We will need transliteration, translation, commentaries, to be sure everyone understands what's happened, and what we do is for the benefit of the patient. It's not a conflict of ego or which one has the right or the power to do it. And the question is how to cooperate without domination. To promote this equity in the field of research and training between biomedicine and Ayurveda, we have to really look evidence-based medicine, and to bring back this evidence-based medicine. It's a good skill. But it was made by biomedicine for biomedicine, because most of the time they ask to measure data and more on measurable factors. Ayurveda, a lot of time cannot match, because even if the Vedya follow Dinacharya or not, I think, and I hope you agree, it will have a great impact in the treatment. But how can we look this through evidence-based medicine? We really need to bring practice-based medicine, allied sciences, Ayurvedic research methodology really adapted to Ayurveda health system. At this point, the question is, what is the more safe? Integrative study and research, or work, or cooperation? For me now, with the knowledge I got, I guess cooperative model is the more safe model for transdisciplinary research and training. Every entity on the same level, horizontal communication and cooperation, and biomedicine, Ayurveda, and this platform, the third place, to promote cognitive justice, can really discuss and look for the best output. One very good article you can read by Professor Sujata, what could integrative medicine mean? Because sometimes integrative, we integrate one medical system in another, and sometimes the other one is the more stronger. It can integrate, but it doesn't allow Ayurveda to integrate biomedicine. So this is a hierarchy we have to avoid. We need a safe horizontal cooperation. One example of third place in France is the International Cooperative University. Lucy is a cooperative to share knowledge, research, experiences, and research training through research within the framework of UN Health Agenda 2030. The third place of experimental prevention devices within the framework of critical public health, based on the concept of One Health. If you read about One Health, lot of description, you can really look Ayurveda as a One Health system. It's a lot of link. So this type of third place can really be helpful to create safely the cooperation with different medical systems. One platform like this cooperate with different universities. This one in Paris cooperate with Fiocruz in Brazil, CES in Portugal, and almost 70 research laboratories. So you have a large vision and transdisciplinary research. They agree to support the creation of one third place like this in India. So I hope we will find great researchers who want to participate to this project. Ayurveda Emergency Care Project is associated with Ayush Ministry from January 2020. I hope many Vedyas and students and practitioners will join this project, because we need now resource persons to be trainers, many masters to guide and give their experience, researchers. We have to work on logistic and material to organize the training. We need to really look and work on the legal aspect, the political aspect too, to be accepted. We need a financial support to create a safe bridge with allopathy. We have to work deeply with the concept of cognitive justice and epistemology of the South, and see what can we use from this concept and really explain this to the different institution, and start to create international cooperation. It will be more easy if this project is supported by different countries. It will make a safe ground, a safe third place. These are the references. I thank you all to listen me, and I hope you can contact us on iuemergency@gmail.com for any queries, any suggestion, if you want more detail. And I really thanked AVP Research Foundation team and Ayush Ministry to support this project. Thank you.
Thank you very much, sir. It was indeed a great session listening to you, sir. We shall now move on to the question and answer session. Delegates can post questions on the chat box.
So, can we get the training with collaboration with the Ayush department of different states? Sure. First, we will ask Ayush Ministry to do the pilot study with maybe 2 or 3 states, Kerala, Tamil Nadu, and Karnataka, and to start the first batch of ACLS to see how it's works. Then we will try to create quickly the first batch of TOT, trainers, training of trainers. And from this, any Vedya or person who want to develop this in different states in India, we can easily connect to Ayush departments. Can IU doctor use lidocaine for the minor cut to suture? This I really don't know. This is a legal question. I'm not. We have to ask one lawyer specifically in medical context and ask him. But I hope the law of India allow the use of any drug in case the patient will die. For minor cuts, I'm not sure. To intubate, to prevent the reflex to come, I hope the law is enough safe to allow everyone, every healer who want and who have a training to save a patient to do it. In France, for sure, we can. Everyone can to save the life. In India, we have to inquire and tell you. When we TOT be in Karnataka. For Ayurvedic doctor, this depends on the work we are going to do with the team who train MBBS. They are now allowed to train ACLS to Ayurvedic doctor. This is for every Vedya can be trained, but for the trainers, now they are not certified by the university. So we need to create a MOU between one university in Kerala, Tamil Nadu, and one university in Bangalore for them to allow. And for this, we need the help for Ayush Ministry to ask MBBS institution to give this training. It's in process, but not done now. So I don't know when. Okay. So I will share the WhatsApp. It's only WhatsApp. Okay. And I will share different references about cognitive justice, epistemology of the South in the chat, so you can click on and see this on Google. So I think this. I think you will. Oh no, sorry, not this.
Delegates can post questions in the chat box.
These are some reference, very, very useful. And it's to know which part of us it's still colonized from the West. And I had worked a lot on this because my brain has a lot of colonization, but everyone has, and how to make the balance in ourselves before going to cooperative work. Is the government allow MBBS graduate to take admission into MD Ayurveda? Oh, I don't know. I think some, I don't know if it's a MD or, I don't know. I don't know this. This you have to inquire Ministry of Ayush. But I know now MBBS will have some syllabus on Ayurveda mandatory in the MBBS. So this is a good step. This I don't know how to allow the chat to be. If you click on, maybe you click on, it will open in the internet, and after you have there, you save it in the internet. Then the allopathy doctor can understand Ayurveda properly. This depends which word we use, and I think if it's really well known by some researcher or Vedya, I heard many Vedya who really explain clearly and with a good example, and you can understand. And if you don't understand with different example, it will take time for sure. But now there is many doctors who were trained in both allopathy and Ayurveda. So maybe they can be the pillar to make the bridge. I know really few of Ayurveda, but I can almost understand all the classes if it's not fully in Sanskrit and too fast, but I get the sense. And so I think if they are interested, if they are open to listen, they can understand. They can understand. In US, lot of allopathic doctor follow Dr. Vasant Lad and ask him a lot of class on Ayurveda, and they get everything, I think. Certified in critical care can use injectable. Yes, you can use injectable. And this is already allowed because this ECLS is already provided to Ayush doctors. So I think in your law, I have to go back to this text. But in case of emergency and life-threatening case, you can use any drug. I think I saw this in one depeche. I have to bring back this text, but the best will be before starting this ACLS to have 1 or 2 lawyers working on and tell us what are the risks, what are the possibility and the law. Yes, I think for emergencies they are allowed if it's acute emergency. If you have time to transfer and the patient is stable, I think let it stable. And if we do extensive research on how we can treat it with Ayurveda, for sure, this will be the second part. After training, we have to research a lot because so many Vedyas share their experience in the web conference in last year, and a lot of good results with Rasa Shastra, Basma, And now I work with Vedya in Kerala, who teach me how to handle cardiac arrest with some basma. So I think this can be studied well, because in allopathy we have very few things: epinephrine, adrenaline, and shock. 2 skills. If we have more from Ayurveda, in case like this, we can start studies. And if we have a result, I think it will be great, and Ayurveda will be more recognized. 12 states allowed practice of allopathy by Ayush. This is a good point. 12 states, I was thinking it was just 2 or 3 like Maharashtra, and 12 states allow practice of allopathy by Ayu. This is the good news. Thank you. This I have to, yeah, very good. Shalia legalized in India, coming anesthesia, how to come over. Shalia legalized. I know it was a training in maybe in BHU or maybe Maharashtra, I don't remember. And they had a training for Shalia Tantra on anesthesiology until 2019, but they stopped it because some conflict and with maybe IMA. But yeah, we have to bring back this. If there is good references, and we have to bring back anesthesia in emergency first. Prana and Pranagamana CPR, anyone can practice if knows. Sure. So now we need Vedyas and students who really want. We can have very good subjects for PG and to study emergency situation, how we can handle, how we can translate what is described in emergency by the allopathic doctor in Ayurvedic terminology, and go to observe in ICU how the patient are, all the lakshanas, and look in the text, what can we use in this condition in ICU? Lot of things to be done. But I didn't know Pranagamana was CPR. Nice. Thank you, everyone. If you have more questions, write to ayuemergency@gmail.com.
Thank you very much, sir, for answering all questions with so much patience. It was great listening to you, sir.
Thank you very much. Thank you, all the attendees and the organizer, AVP Research Foundation, Ayush Ministry, and my pranams to Krishna Kumarji, who was at the beginning of this project. Thank you.
Now, I welcome Dr. Gidu Mohandas, Assistant.
Am I audible? Am I audible?
Yes, ma'am.
Okay, thank you. Thank you for inviting me for the vote of thanks. On behalf of Ayurveda College Coimbatore, I extend a really hearty vote of thanks to Dr. Mayel Vogeli, who spared time from his busier schedule. Today, we had an opportunity to hear your valuable experience and views on our emergency care project, and and this will surely be going to encourage us. This presentation have enlightened our mind and have shown us a new path. Thank you, sir. Thank you so much. A special mention to our
Thank you, ma'am.
respected principal, Dr. Chandramouli sir, for standing as a pillar of strength in this webinar. I would like to thank the people who work behind the scenes to make this event happen. Last but not the least, let me thank all our delegates who have responded so well to our invitation and made it a grand success. We look forward to welcome you again in our coming section. Thank you, one and all. Thank you.
Thank you, ma'am. We are honored to be present with you for today's session, sir. It was great listening to you. I express my heartfelt gratitude to our guest speaker who had managed to join us despite his busy schedule. Thank you, sir. With this, we have come to the end of the session. The next session is on global perspective of understanding plants through Ayurveda principles and reporting of misleading advertisement of ASU and H drugs initiative taken by Ministry of Ayush on September 4, 2021 at 6 p.m. To know more about our updates, please do stay connected with our social platform. Thank you to all the participants and wish to see you all in the next session of SAMSIDDHI 2021 National Web Conference Series organized by Ayurveda College Coimbatore, powered by DIKSHA E-Learning. Thank you all. Have a great day.